Hi there, I'm Mabel Jong, and you're watching the World Healthcare Congress Executive Studio. I'm so pleased to welcome Stan Nowak to the chair. He is the CEO and co-founder of Silverlink Communications. Good morning.
Thank you. Good morning, Mabel.
Now tell me a little bit about Silverlink Communications.
So Silverlink is a company that works in the healthcare market. We've been around for about 11 years now. And we motivate consumer behaviors using technologies. So we're a consumer engagement company in healthcare, working principally for payers, insurers, providers, increasingly pharmacies, to motivate different types of health behaviors in consumers.
Okay, now we're seeing a very dramatic shift in the healthcare market. We're changing from a wholesale market, if you will, to more of a consumer-driven market, a retail market.
Absolutely.
How big of a game changer is that?
It's a massive game changer, and this market, as you say, has been a wholesale market where employers have been the primary customers, and it's been an employer-based healthcare system. So as we move to the exchange market, where individuals are purchasing insurance for themselves, that's a fundamental change in this marketplace. And we saw this change a little bit happen in the with the Medicare Modernization Act in 2006 and the implementation of Medicare Part D. We saw sort of a massive change in the benefits for seniors in a consumer product structure. So we've been through a small version of the coming change. This is very different as well. It's going to be an extremely confusing time for consumers.
Do consumers want to take these decisions on?
I think they want to have coverage. They want the security of coverage, and they don't have any idea what the decisions and the process is going to be over the next few years. We're going to learn over the next few years how consumers interact in this new marketplace. But it is going to be a big change. I don't know if you saw some of the coverage around the application for individual insurance over the weekend. There were a number of articles about it being harder than the tax code and all
Absolutely.
of that. So I think there's going to be, as we start the program, and remember this is both federal and state, so and the regulations are still being issued. So we really don't know what the experience is going to be, but it's going to be a real change for consumers.
So, and that provides opportunity for you, really trying to educate consumers and engage them in the process. Is that a difficult task?
It is, and I think we for 10 years have been working, engaging consumers in their own health, and there are a couple of different ways you do that. One is managing their own health, so managing their chronic conditions or managing their medications or getting screened for diseases. And in that category, there are three groups of people. There are the willing and able, and those are the easy ones, right? Those are the people who go to the website, do it all electronically. There are the unwilling, and they're either healthy or sick, but it's none of your damn business, right? So, and you can't really impact them. And then there are the willing but unable, people who don't have information, people who don't know the questions to ask. So in the health management world, there are three segments. In that third segment, you can really move the needle in terms of whether they get their screenings, whether they care for their chronic conditions, whether they enroll in a disease management program to manage their diabetes. You can actually impact that third group, and there's a lot of them in the U.S. That are in that third category. But that's the area of health management. In the administrative world, which a lot of the health exchange world is right now, and a lot of the confusion is going to be around that, that's a different set of issues. So engaging people around these large areas of administrative complexity and eliminating confusion, honestly, in this market, clearly for a company like Silverlink, that's going to be a massive opportunity this year as confusion sets in and as the states are trying to confuse, if you think about a consumer, they're going to be hearing messages from the states, from competitive healthcare providers, both insurers and providers in their local markets. They're going to be hearing messages from the federal government. There are going to be a lot of laws that are being issued both at the state and the federal level, and they're going to overlap. So it is going to be an extremely confusing time.
Now you've talked about different groups of communities of people that you need to come up with solutions or come up with ideas on how to get them engaged. Can you give me an example of each group and maybe a method that you go to work with them?
What we've done at Silverlink for many years is use marketing analytics methodologies to micro-segment populations. So honestly, in each behavior class, in each behavior category, and in each market, there are different segments of the population that you need to address. So what we've been able to do with technology is use champion challenger techniques to test which incentives, which messages work best within which subpopulations. And this is something that always works. We're using the same technologies and methodologies that Capital One uses to send you those credit card offers in the mail.
Okay.
We're changing the strategies and we're watching how they perform. And that's been a big part of our business. So there's no one answer to that question. The segments change. Motivation for behavior change also changes. And in a moving regulatory environment, we expect we're just going to have to be ready to, look at the data and act quickly on it.
How is Silverlink getting ready for the deadline in October when we're going to see all of the online exchanges start to operate? I'm sure there are going to be different versions of that, but the rollout is in October.
Right.
So what are you doing at Silverlink?
Well, again, it's a market that we're in sort of what we call the regulated retail market, right? So the managed Medicare market, managed Medicaid market are good learning centers for that. So we work in that business every day. So we know the basic construct of how do you execute programs that require regulatory approval, that may require a couple of levels of regulatory approval. How does that approval process work? And but it starts with interpreting the regulations. So,
okay.
There are a number of things that need to be done, and that's what people will want to do first. That's what our clients will want to do first. So understand the regulations and reach out to populations to help, to be adherent to the regulations. And so we're interpreting the regs. We have people who are reading the regs and helping us understand what that means, and then we translate that into programs that we then talk to our clients about.
And you have some great examples that are of systems that already work. For instance, you had a chance to speak on a panel with Target, which I got to talk with as well yesterday. And we can learn a lot from the retail environment,
Absolutely.
can't we?
Absolutely.
From an organization that seems to have done that very well.
Oh, exactly right. I mean, in healthcare, we're constantly looking outside the market to figure out what lessons we can learn from other industries. And Target is obviously in the healthcare market and has been for 50 years. They can teach us a lot about how to engage with consumers. They also have advantages that much of the healthcare system doesn't have. They have great stores, people feel happy when they're in them, and they have shelf space. Much of the market, the insurance market, for example, is a very abstract market. There is no building you go to as a health insurance customer. But we can learn, how do they use data? How do they how do they engage their customers? How do they create relationships? How do they create brand? And the healthcare market honestly needs to work hard on brand affinity, brand loyalty, and all of that in this new market.
Let's go back to your company is based on a lot of what you have personally experienced.
Sure.
What do you do in terms of wellness, and how do you start at home with that?
Well, I'll tell you, a few years ago I was at the doctor and they said my triglycerides were high as part of my cholesterol, and that's the easiest to impact. And they wanted to put me on a statin, and I said I didn't want to do that at that point. And so I changed a lot of my behaviors, my diet, my exercise, and it actually was able in 6 months to drop my triglycerides by 100 points. And that was sort of a big deal to me and very impactful to me. But it kept me off medication. So every day I'm doing things that are keeping my health in mind. But I work on a treadmill desk,
right.
A lot of the day. So that's been a big change. I did that about 5 months ago and managed to just gain a little bit of weight.
Okay.
So it wasn't as successful as I hoped, but
maybe you should stop eating the donut while you're walking on
That's
the treadmill.
true. The problem is it has a flat surface. You can put lots of food, lots of fondue and donuts on that. But
right.
So those are just a couple of the things that I do personally. I run, and I hate running.
Okay.
So, you know, I do a lot of things I don't want to do, but
Right.
I do it so that I can
Sometimes
be
you
around
just
for
got
the
to
kids.
do it.
Yeah.
Okay. And you know, we've learned a lot from you here. You seem to have learned a lot from the conference. Is there anything that I've missed that
No, I think this is you know, we're always learning, and this is a time for the market to learn about consumers, and you know, I think the next 6 months are going to be a point of real change, and you know, health plans and providers are struggling with, you know, how do they interact with this new consumer that has a whole set of new challenges while doing it at low cost, and that's where you have an opportunity to use technologies to do things that you might otherwise do with people or customer service or nurses. And so there are tremendous opportunities for us. It's going to be a very exciting time. I don't think there's been a more exciting time in healthcare for the past 30 years as the next, you know, 18 months as we roll this out.
All right, Stan Nowak, thank you so much for your
Mabel,
time
thank
today.
you so much.
I appreciate it. It's been a pleasure.
Great talking to you.
And I'm Mabel Zhang. Thanks so much for watching.